He's saying, what is the test to make a diagnosis of rheumatoid arthritis? Rheumatoid arthritis is mainly a clinical diagnosis. To substantiate the diagnosis, we do a test for rheumatoid factor, another test called anti-CCP. But what is very important is the clinical presentation. If they have a classical inflammatory arthritis affecting the smaller joints of the hands and feet associated with early morning stiffness, it is rheumatoid. But we just do a test. Just because the lab test is negative, it does not mean that they do not have rheumatoid arthritis.
And sclerosis patient, how often should go for ANA test?
People with scleroderma need not go for a repeat ANA test at all. Scleroderma, it has affected the skin, it can affect the lung, it can affect the heart, it can affect the abdomen. No reloading. Once it is scleroderma, do not repeat the ANA test at all.
Does seronegativity RA really exist? Supplements for lupus.
Supplements for lupus. Yeah, the supplements have become very popular, especially after COVID. Immunostimulants, this drug, that drug, this antioxidant. Nothing, no research has been found. Let me tell you one thing. There is no supplement for treatment of lupus. Take allopathy, take medications prescribed by the doctor. These supplements may do you good, may not do you harm. None of my patients, I put them on supplement. It's all exorbitantly costly. See, there was a study which showed most of the multivitamins we took went into the sewage, and the rats are more healthier than human beings. So some people say, if I take one tablet multivitamin, absolutely energetic. It's all psychic, it's all mind in the mind. If you take an adequate, well-balanced, nutritious diet, there's no need to take multivitamins at all. Sorry, I'm crossing swords.
Then yoga and eating green reverse RV.
No, but not yoga and eating green leafy vegetables cannot reverse rheumatoid arthritis. Yoga is supplementary. What is yoga? It is nothing but putting your joints into various motion. It also gives you a sense of well-being. It calms your mind. Pranayama also cures your mind. Yoga is very blissful. It doesn't just have good effects on the body. It has very good effects on the mind. That's very important. Everybody should do yoga. That's extremely good. Vegetables cannot reverse the process of reversing the process. Some YouTube channel saying that protein-rich food is not good for RA. Is it correct? The YouTube is wrong. Who said that? Nothing like that. Nothing. No, definitely not. Why RA patients are getting weight loss? Usually, rheumatoid arthritis patients do not lose weight. If they are taking multiple medications which cause gastritis, it can cause a fall in the appetite. So, when it causes a fall in appetite, they may not take adequate food. Sometimes they can have gastritis. Sometimes they can have loss of weight due to other causes like diarrhea, which is not due to the rheumatoid arthritis. Sometimes they can develop infections like TB if they are on biologics. So, loss of weight has to be addressed by the physician. Me being the daughter, what are the chances of getting a disease? Should I conduct regular tests with the symptoms? Fantastic question. Just because the parents have rheumatoid arthritis or systemic lupus or spondyloarthritis, it is absolutely crazy and nonsense to do these tests in the children. Please don't do that. People become psychic, not the parents, but the children. Unnecessarily, they have said your ANA is positive. Please do not do any test in an asymptomatic patient at all. Unless any problem is there, you have consulted a doctor and the doctor feels it is right to prescribe a diagnostic test, he will do it. Just don't go to a lab and order. I see so many of my patients without my knowledge, they'll come with a battery of 23 investigations, spending about 10,000 rupees. And one small test will be positive. Immediately he'll say, I got SLE, I got rheumatoid, I'll develop ankylosing. Especially this HLA-B27 is done for making a diagnosis of ankylosing spondylitis. There are so many people who are walking around the world with HLA-B27. And every day they'll come and ask me, will I develop ankylosing spondylitis? Will I develop ankylosing spondylitis? They won't develop ankylosing spondylitis. They develop ischemic heart disease due to stress. Never do any test unnecessarily without a consultation. And the doctor has to do it. That's very important. Sugar also showing high when has been in control in all. Sugar is high, you may have to consult the diabetologist. Some are Ultraset and Etavoa tablet good for spondyloarthritis. Yes, please explain about spondyloarthritis. I've explained in detail. It's a condition which affects the spine, genetically inherited. The pelvic joint gets affected, then the spine gets affected. It's an autoimmune disease. It progresses to make the spine very stiff and straight. Early diagnosis, early treatment with biologics, regular exercise program, very good prognosis if you follow the line of treatment. That is spondyloarthritis.
I'm not able to climbing the staircase. Is this arthritis?
Yes, if you're not able to climb up the stairs, you may have to consult your physician or a general practitioner to exclude the process of osteoarthritis of the knee. That's very important.
Can RA be reversed?
Can RA be reversed? I said, already I told you, we can control the disease, but what has happened to the joint has already happened. We can't reverse the process of the joint being destroyed. What has happened has happened. That's very important. You have to accept it. But it can be controlled, and in some people, good number of people, it can also go into complete remission. Remission means nearly cured. But for a chronic disease, we do not use cure the word, we use remission because sometimes it may get this head up again.